All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. The discussion that we'll do today is about the pathology of type 2 diabetes mellitus, or the mechanisms that are involved in it. So yesterday the discussion was what happens once the glucose is increased in the blood and interstitial tissue, and what is the damage because of that. Today we are going one step behind that and seeing what happens to the regulatory system itself, which is supposed to keep the glucose in the right levels. What is wrong there? And once we understand the mechanism of the pathology of the glucose regulation, then we'll go one step behind that and understand that do we have to, number one, how do we prevent diabetes? What are good lifestyle habits? What are good nutritional habits that can help us prevent it or delay it? And number two, if we have it, how do we make sure that we can try to reverse it, or if not exactly reverse it, how do we reduce our dependence on the medication, and how do we not become insulin dependent? So these are the kind of things. And once we have the insulin dependence, what would happen? What do we do at that time to kind of keep the effects lower? So today, really just the second mechanism, what the mechanism is pathology of insulin resistance. So that is where we are going. So let's see. At the end of the day today, what we should take away was, if I am diabetic, what happened in me that I became diabetic? So let's see. So imagine this is a cell, any normal cell. The cell needs glucose. And imagine this is the glucose channel, or called GLUT, glucose transporter. The function of this channel is to allow glucose from here to enter the cell. But the glucose cannot just enter the cell by itself. There are 30% of our body's tissue can have glucose enter them without insulin. For example, brain can use glucose without the need for insulin. Or we know that pancreatic cells themselves, the beta cells themselves, do not need insulin to have the glucose enter in those cells. However, 70% of the cells need the presence of insulin. So if you see here, this hand is the insulin. When insulin is present, it will bind to a receptor on the cell, insulin receptor, and it would create a set of actions within the cell. This is like ringing the doorbell. And when you ring the doorbell inside the home, there are people who would listen to that bell and then they would go and open the door. Just like that, when the insulin binds to the receptor, there are internal mechanisms that become activated inside the cell. Eventually, the glucose transporter opens up, and that allows the glucose to get into the cell. That glucose will then be used to make energy and do the cell functions. If for some reason this mechanism that goes from insulin ringing the bell and opening the door, if that mechanism is not working, for example, people are sleeping at home and you are ringing the doorbell and nobody is waking up to go and open the door, then the glucose cannot get into the cell and it cannot function. Result is that, number one, the cell is not functioning correctly, and number two, we have glucose piling up outside, and we saw yesterday what is the result of that. So now we are going to focus here that what happens, why are the people sleeping? Why are we not getting the response to insulin? So let's see. The type 2 diabetes mellitus. I'm not talking about type 1. I'm not talking about genetic factors. I am going directly to the mechanism that is broken in diabetes. In type 2 diabetes, there are two basic problems that occur: insulin resistance and beta cell dysfunction. And let me explain it just in 5 seconds here, and I think that would just cover the whole story. Imagine that you have a car and you are driving that car and you want to go fast, but car is not going fast, there is some issue, and you keep pumping the gas and you keep causing the engine to rotate fast and churn fast and work fast, but still it is not going fast enough for your satisfaction, so you keep revving it. What would happen? Eventually the car is going to burn out. This is what we mean by beta cell dysfunction over here. But the basic problem is insulin resistance. So we're going to look at that today, and then we'll see once the insulin resistance occurs, what happens to the beta cell. Imagine that beta cells are the factories, these are the engines that are making insulin. If you drive them too fast, they're going to burn out. And the machinery is going to break down. There will be a disaster, and we have to keep an eye on that today. So let's see. Insulin resistance. So here is a first problem. The problem is that insulin is present, and when the insulin attaches to the receptor on the peripheral tissue, and when I say peripheral tissue, what I mean by that is the muscle cells, the other tissue cells, the skin cell, and so many, all of our tissue cells. When insulin binds there, the internal mechanisms are broken and the glut receptors do not open up. Now, what happens as a result? This is a beta cell. This is sitting in pancreas. This cell's function is to release insulin. And we saw yesterday that this cell is actually a glucometer. It gets the glucose level in the tissue surrounding it, and in the blood. It is perfused heavily with blood. So we keep giving it lots of blood, and it measures the glucose in that blood. And then based on the amount of glucose present in the blood, its function is to release insulin. Now, what is the result of releasing the insulin? The result of that should be that insulin should go open up the doors for glucose to get into the cells, and glucose levels should reduce. But what if that does not happen? What if we have a resistance going on? What if the people are sleeping and nobody is opening up the door for the glucose to get into the cells? The result is this poor guy doesn't know that the peripheral tissue is not working correctly, not responding to insulin. It simply thinks that the glucose levels are still very high because I'm not making enough insulin. So what would it do? Make more insulin and more insulin and more insulin. Eventually, this guy is going to burn out and die. So keep an eye. Why will it die when it is working more? So the beta cell dysfunction, see, we don't say beta cell death. We don't say beta cell overfunction. We don't say beta cell lower function, reduced function. We use the term dysfunction because in the beginning, when we are becoming diabetic, in the beginning, beta cells are working more. Actually, one can pick up that somebody is becoming diabetic if we can measure their insulin levels on daily basis. Just like today we can measure our glucose levels. Imagine instead of measuring the glucose level, if we can measure the insulin level. Why is that? Let's say I am becoming diabetic. That means my peripheral tissue, my muscle cells, my skin cells, my GIT cells, my cardiovascular system cells, my tissue cells are not responding correctly to glucose. The result of that resistance is that the beta cells are under stress to produce a lots of insulin. So they will produce a lots of insulin. They are healthy cells, they're young cells, they can produce insulin, and they do produce it. When they produce a lots of insulin, the result is this, that extra insulin is going to be able to drive glucose into the cells by ringing the doorbell again and again and like crazy, or by attaching to a lots of receptors and opening up whatever glucose channels they can. And so when you test your glucose, it would be normal. Why would it be normal? Because there is a lot of insulin out in the blood, and that is keeping the glucose getting into the cells. So you would look at your glucose levels and you say, well, I am fine. But if you looked at the insulin levels, you might see the insulin levels doubling because the beta cells are working more, and now we need twice the amount of insulin to do the normal function. So that is the first dysregulation or abnormality of the beta cell function, that they are working more. We will call that hyperfunction. So in the early phases, when there is no diabetes yet, but the person is becoming diabetic, beta cells are working more. Then slowly these extra working beta cells, these hard working beta cells, these cells under stress are going to start burnout. They are like light bulbs that are going to start popping and burning. And as they start burning, now the remaining cells that are producing insulin, they cannot produce enough insulin to keep the glucose going into the cells. And now the glucose levels are going to start rising. And if we measure them now, we'll say, oh man, we have hyperglycemia. So question then is, why would these cells die? So let's look at that. The outcome of the situation with diabetes are very interesting. Number one, when the insulin resistance appears, we still do not know why it appears, right? But we're talking about when it appears, what happens in the muscles, for example. Muscle fail to take up glucose. Muscle is a big unit of tissue in us that takes up a lot of glucose and uses it. So when the insulin is not working correctly, when the peripheral resistance is there, we do not know why it is there. We'll talk about that a little later. The muscles are not picking up the glucose. That means the glucose is just running around in the blood vessels and in the tissues. And as we talked yesterday, it is causing osmotic pressure issues, and it is causing non-enzymatic glycation and causing the tissue dysfunctions. And an interesting thing happens to liver as well. Now think about it. Liver's job is to help keep the blood glucose levels at normal by either storing the extra glucose, or if we are in a fasting state, by making extra glucose when the glucose levels are going down from the stored glucose levels. So what happens? Tissues are not using glucose. Glucose levels are high in the blood, but inside the cells, glucose levels are low. That is happening in the liver as well. So what happens is, in the liver, glycolysis is reduced. What does that mean? That means the liver cell, if this is a liver cell, my hand, and its job is to take glucose and break it down, that is called glycolysis. Lysis means breaking down, glyco means sugar. So glucose, the liver cell's function is to break down the glucose. It will not be breaking down glucose. Why? Because it is not responding to insulin, just like other tissues not responding to insulin. So when insulin is there and trying to make it work, it's not working. And so there is not enough glucose in the liver cells, and liver cells are not doing glycolysis. That is one issue. Liver cells are also not doing free fatty acid oxidation or fatty acid oxidation, which is another function related to glucose levels. And finally, liver cell would continue to make new glucose. Why? Because the liver cell's function is also to see how much insulin is present, how much glucose is present. And if we have low glucose levels, liver cell's function is to say, oh man, this person is not eating enough glucose, because liver cell doesn't know that there is glucose running around. It is measuring the glucose inside. It is measuring the insulin function. And it is not able to see the glucose inside its own cell. So it is saying, oh man, there is not enough glucose. My job is to produce glucose now from the storage. So it is going to start making new glucose from the stored energy that we have in adipose tissues and in glycogen. Result is, as we are eating food, we are accumulating glucose in the body. And at the same time, liver is also making new glucose. So we have two factories of glucose going on, one from outside and one from liver. And that just keeps increasing the glucose levels. Cells are starving. They don't have glucose. They don't have energy. They're dying. They want more. But insulin is not able to do the function because the cells are resistant. So question, why are cells resistant? So let's look at that now. So mechanism for insulin resistance. There are two mechanisms I'm going to describe now. Number one, how does the insulin resistance occur? And number two, why do beta cells die? So again, two things: peripheral tissue resistance and beta cell dysfunction. So I'm going to mix those two mechanisms together. And those cool beans who have been with me since 1 year, and we have talked about immunology, you would see the immune system's effect here. Macrophages and T cells will be used here to produce diabetes as well. And you would see that anti-inflammatory, so the newer technologies for controlling diabetes are anti-inflammatory instead of just insulin, pro-insulin. So let's see. Here is a fat cell, adipocyte. Adipocyte are the fat cells. And now, while you're listening to this, please do me a favor, pinch your fats on your stomach, if you have, on your belly, and see that can you pinch your fats or not. There is two type of fat that we can accumulate. One is the fat inside our GIT, inside our stomach, around our intestine, or that is called visceral fat. Fat around the liver, fat around the intestine, and fat inside our stomach. You cannot pinch it from outside. You might see that there is a bulging stomach. You might be overweight, but you cannot pinch the fat. Why can you not pinch the fat? It is inside. The visceral fat is visceral fat is more dangerous than non-visceral fat. What is non-visceral fat? If you pinch your tummy and you can actually pinch your fat, that means it is accumulating outside of the GIT. That is less dangerous. And many times some obese people, you look at them and you'll say, they are obese, but why do they not have diabetes? And then you say, well, that means that this correlation of obesity to diabetes is wrong. No, there are multiple possibilities. One, they may not have visceral fat yet. They may have the early phase of diabetes that they do not know that insulin is actually keeping them sustained. So let's see. Here is a fat cell. The fat cell's job is to store energy or fats and then to release energy or fats. It releases them in the form of free fatty acids. These free fatty acids, it can store them as well. It can release them as well. So when we are sleeping, for example, and we are not eating anything, and we need energy, the adipocytes, the fat cells, are going to release free fatty acids at a continuous rate, and that free fatty acid in the liver will be then converted into glucose, and our cells would use them. So these free fatty acids production is a normal thing. But when our body is not responding to insulin and we do not have glucose going into the cells, then our cells are going to be yelling and saying, we need more energy. And the fat cells would say, okay, I'll give you more free fatty acids. Then those folks who may have the right insulin, but they're just eating too much, or they may have a genetic predisposition. The end result, eating too much or genetic predisposition or insulin problems, whatever the end result is, whatever is the cause, if the end result is that they are obese, that means they would actually produce more fatty acids than normal people or non-obese people. I should not say normal, we're all normal, but non-obese people will produce less free fatty acids compared to obese. Now, these free fatty acids are the basis for all the rest of the problems leading up to diabetes. And now please remember, it is not necessary that somebody has to be obese to have them. There are genetic predispositions as well. There are lifestyle predispositions as well. And there is obesity as well. So check this out. Imagine that these are the free fatty acids that are poured in the blood by free adipocytes. They are just making too much free fatty acids, maybe because I'm obese. Let's use me as an example. I am obese. My fat cells are making a lot of free fatty acids, and they are releasing them in the body because they just have too many of them, the free fatty acids. These extra free fatty acids will enter all the tissue cells. Why would they enter all the tissue cells? Because there are too many of free fatty acids. They would get into the cells. When they get into the cells, now please, this is the punchline for the whole discussion. Inside here, The mechanism that goes from insulin receptor action, that is insulin ringing the bell, to opening the door. This internal mechanism, the people in the home that are going to open the door, free fatty acids and triglycerides and free fatty acid products inside the cell. These are all the things that are made from fat. They get stuck in these enzymes. This is like putting super glue in a door. Or this is like if you have a machine that has gears, throwing a wrench in the gear and making the gears get stuck. So these free fatty acids that have accumulated in the tissue will get stuck with the insulin signaling mechanisms. They would disrupt them. They would make them not function correctly. The result is insulin is present, but the door is not opening. Glucose is not going in. Glucose is accumulating outside. Diabetes has occurred. The reason is free fatty acids. And we'll go one step behind this as well in the coming days to say, why do we have more free fatty acids? What are the genetic predisposition? What is the reason for nutritional issues? Why are we eating wrong to cause free fatty acids? What is the problem with obesity? And so on. So we'll do those discussions too. But today we want to see this mechanism. So what happens is these free fatty acids products, triglycerides, they inhibit the signaling mechanism. Good. So now we know what is going on. Let's continue that. Okay, fine. This is what is happening. Then what? Free fatty acids are present. Insulin is not working. This is called peripheral tissues insulin resistance. Now let's see what is going to happen to the poor beta cells. Beta cells function is to say, I'm going to give you insulin, which would help you drive the glucose inside the cells. Peripheral tissue is not responding to insulin. Beta cells do not know that. They are blaming themselves to say, maybe we are not producing enough insulin. So let's see what's going on with the beta cells. Here is a beta cell. We know that beta cells' job, let me just keep it bigger. Beta cells' job is to make insulin, right? And they allow free entry of glucose in them. They are like glucometers. So when we get increased glucose in our blood, there will be increased glucose in the beta cell. Isn't that increased energy in the beta cell? So keep an eye on this, that I'm going to excite these beta cells. I'm going to make them like little children who have eaten candies, and they're bouncing off the walls. We're going to make these beta cells bounce off the walls. So number one, they have a lot of glucose. Imagine a person who is already diabetic. They have a lot of glucose in their blood, and that blood is bathing the beta cell. It is showering the beta cell with that blood, which is full of candy, and that candy is entering the beta cell. So they have a lot of energy to work with. Number one. Number two, they are getting a lot of fatty acids as well. And they are getting a lot of fatty acid byproducts like triglycerides and other fatty acid products. They are full of all kinds of energy. The result of that is that when they are full of energy, they make a lot of insulin. Good. They make a lot of insulin, good thing. But at the same time, they also make a lot of islet amyloid polypeptide. What is that? It's a protein. Whenever we make insulin, imagine we make some raw material extra with it. Some polypeptide. It's a tiny protein. So as the beta cell is revving fast and that machine is going, it has lots of energy and it is making insulin. It is also making some extra raw material that is just falling next to the machine itself. It is accumulating there, and soon that machine is going to be drowned in that little polyprotein, and it's going to die, this machine. Imagine if you're running a machine which is spewing out something, which is spitting out something that is just accumulating around that machine. Eventually that machine would drown out and die. So this is one important thing, not just the insulin, there is islet amyloid polypeptide or some protein being made that is getting stuck in that environment, which is working more. Okay, what else? When beta cells work more, and this is true for all of our cells, when a cell is working more, it starts noticing that I'm working more, and it starts telling the inflammatory system, the immune system, to say, guys, I am working a lot. I'm not supposed to be working so much. Somehow I'm working a lot. And how does it tell them? It tells them by releasing cytokines. You know that cytokines can be released by all of our cells. Any cell under stress would produce cytokines and say, I am in trouble. There is something wrong going on. So the beta cell, which is revving fast, is going to make cytokines. We know now for the whole year studying that cytokines would bring in inflammatory cells in that area. And these cells, these monocytes and macrophages and T cells and B cells, they're going to come in this natural killer cells and neutrophils. They're going to start killing the local cells. Inflammation is occurring because of extra energy. And because of fast, imagine you put 1 billion cars together and rev all the engines of those 1 billion cars. That's what's happening in pancreas. Extra dirty material, the polypeptide protein is produced, plus so much car engines are burning just because they're overworked. And then people and police and others are going to come in and say, what the heck are you doing? And they're going to start switching the cars off and destroy them. That is the immune system. So the beta cell, which is more energetic now, is producing cytokines. At the same time, please now pay attention here. At the same time, in every tissue, we have macrophages. They live in every tissue. Now, macrophages are also getting extra energy. Why? Because we have lots of free fatty acids. Let's say I'm obese. I have lots of free fatty acids. Those free fatty acids are also going to go to macrophages. And when macrophages get lots of free fatty acids, they start producing a lot of inflammatory cytokines. They're inflammasomes. Inflammasomes are small particles, small pulses in the macrophages that have inflammatory cytokines in them. And macrophages are going to start releasing them when there is too much free fatty acids. When there is too much glucose, they're fine. They'll make ATP and they'll be okay. But when you give them too much free fatty acids, they'll become disturbed. Just like giving type of nutrition. If you give somebody, let's say, a burger, they're happy. I like burger, I've taken it. But if you give them too much of soups, they would throw a tantrum and say, I don't want to have soup. That's what's happening here. The macrophage, if you give them glucose, they're fine. They work. But if you give them too much free fatty acids, they start throwing a tantrum, and their tantrum is inflammasomes. Inflammasomes are inflammatory cytokines, and they are going to start releasing them as well. Inflammation is occurring. Now, when they start releasing inflammatory proteins, the most important one that we've been talking for a year in the COVID context, interleukin-1. Interleukin-1 will cause other local macrophages to become active as well. And remember, when macrophages are active, they're going to eat up things around them. They are cleaners. They are debris eaters. They are the big eaters in our body. So these macrophages that have become activated now are going to just start causing destruction. This is called micro-inflammatory environment. Within the pancreas, this environment of cytokine production and inflammation is occurring. Within the pancreas, cells are going to start dying. Okay, so this is one outcome now of the macrophage. The other outcome is that as the macrophages are producing cytokines, those cytokines in general are going to cause inflammation as well. So now the cytokines are coming from two places. Excited beta cells, overworking beta cells, more energetic beta cells are producing cytokines. Then the macrophages are producing cytokines. These cytokines are going to cause inflammation. Inflammation simply means they're going to cause more macrophages and monocytes and T cells and B cells and NK cells and neutrophils to come over and start fighting. This is an unknown war. This war should not have happened, but it is going to happen. The result, destruction of the cells. We know this from COVID now. We've been talking about it. When the inflammation system goes mad, it starts killing whatever tissue is around. So a person who was obese, a person who had more fatty acids, a person who ate more or who had genetic problems, their free fatty acids have caused their beta cell to produce inflammation or cytokines. That has caused their macrophages to produce cytokines. That has resulted in the beta cell destruction. And then this is a very important thing. When cytokines are produced, we are seeing this with COVID as well. When inflammatory or stress hormones and substances are produced, they reduce the usage of glucose. They produce insulin resistance. Remember, I almost say it so many times that we need to be relaxed. So these inflammatory cytokines actually reduce the usage of glucose. Why do they do that? Here is a problem. Our immune system just knows this, that whenever we are under stress, we are going to, or whenever we are normal, we are going to run around. We are like hunters and we are running all the time. So the immune system says, you know what? I don't want the glucose to be used by anything but for the muscles so that we can run. Immune system thinks every stress can be alleviated by running. So what it does is it tells the whole body's tissues to say, do not use insulin. Do not use, glucose. Keep glucose available for the muscles when they decide to start running. So whenever we have any stressful situation, whenever we have any inflammation, the outcome is reduced use of glucose in certain tissues and more use of glucose in the skeletal tissue or muscles. And this is done by increasing the peripheral tissue resistance to insulin. So what's the outcome here? The outcome is beta cells are now revving. Macrophages in the pancreas are producing cytokines. More macrophages are becoming active and destroying the beta cells. Plus more inflammation is occurring, which is bringing more immune system cells that are going to go cause local destruction. Plus the cytokines that are going out in the inflammatory in the system now is asking the cells not to use glucose so we can save it for the muscle. And there is already plenty of glucose. So the diabetes just keeps becoming worse. Okay, then what? The adipocytes. Adipocytes are funny. Well, they're looking funny here because of the diagram. Adipocytes' function is to store the energy and then release the energy when needed. But when we have just too much energy, or when we have too much fats, or when we have too much of these things available that make up energy, then what they do is they release a lot of free fatty acid. They just have a lot of that. When they have a lots of free fatty acids, it's funny that these free fatty acids can actually act back on the adipocyte. So let's say if I'm an adipocyte and I'm releasing free fatty acids because I have a lot of them, these free fatty acids are going to attach back to me and stimulate me and say, dude, we are a lot of free fatty acids here. The result of that is when adipocyte sends too much free fatty acids, which they are releasing, plus there is more coming from the other tissues, they start releasing interleukins as well. So even the fat in an obese person would start releasing inflammatory cytokines to say, dude, something is wrong. This person has a lot of free fatty acids. And that would, once again, pro-inflammatory cytokines released would cause insulin resistance, would cause inflammation, and once again, we have a problem. So adipocytes are not helping as well in a situation when there is too much energy available or fats available. Now, interestingly, adipocyte can go the other way as well. And we have a set of drugs that help this way. Adipocytes have a gene in their nucleus, actually all of our cells, but adipocytes use that more often. That gene is called peroxisome proliferator activated receptor gamma. gene expression. So there is a protein that is expressed in adipocyte. If it is expressed more, then it causes the adipocyte to produce adiponectin. And adiponectin is actually anti-inflammatory, and it actually helps reduce the diabetes. So adipocyte can go both ways depending upon how we treat them. And we would discuss in the future how to treat them better, just like we know how to treat NK cells better. We have to love these little cells and we have to kind of care for them. And if we care for them, they work for us correctly. So free fatty acids, when they are less, and this gene is open for the PPAR gamma, then adipocytes make more adiponectins, and more adiponectins will cause the free fatty acids to be taken up by adipocyte. And these free fatty acids would not go to liver and other tissues and cause issues. Good. So more energy has caused all of this destruction. And then finally, check this out. What is happening to beta cells? We wanted to see how the destruction is occurring. This is the landscape disaster in the pancreas. Number one, imagine all of these blue destroying cells are beta cells. Number one, they are overworked because we are just giving them too much glucose. And number two, the glucose is not used by the peripheral tissue. These cells just continue to make insulin because they think we are not making sufficient insulin. So because of overworking, they're going to die. Why would they die with the overwork? Many cells in our body, when they work more than normal, other than producing cytokines, they can actually cause apoptosis. The stress signal within the cell can cause apoptosis, or caspases are the proteins that are released. These caspases would tell the cell to kill itself. They would say, you're working too much, just kill yourself. So the cells can actually destroy themselves if they're working too much. One. Second, these cells are producing lots of inflammatory cytokines. Third, the local area, I'm so sorry that Luffy is now going nuts. The local inflammatory systems are producing lots of cytokines. So imagine this, overworked cells, dirty with amyloids. Whenever insulin is produced, amyloids are produced. These red things are amyloids. Amyloids are destructive proteins that are just accumulating in the local area. They're like trash present around, let's say, a restaurant. And that trash, as it would accumulate, it would cause destruction. And then the inflammation, just inflammation. So what would happen is a person who is becoming diabetic, in the beginning, beta cells are working more, but the person doesn't actually know that I'm becoming diabetic because his beta cells are still producing sufficient insulin. Then they become insufficient because of the local inflammation and the beta cells are dying. And then finally, they die so much when more than 85% of beta cells are dead. Then the person becomes insulin dependent because there is not sufficient insulin that can be produced from inside. All of this happened because there was peripheral tissue resistance to insulin. And that happened because there was more free fatty acids. And that happened because of our lifestyle, because of our nutrition, and sometimes our genetics as well. So this is the discussion for today. This is the mechanism or pathology of diabetes. Now we'll go one step behind this as well to see why did we end up with more free fatty acids if we eat more, and what kind of foods are causing it. And is it true that vegetarians who are taking more, let's say, healthy food, they have less diabetes or less obesity and so on? So we'll do those discussions. Then we'll go to drugs. Outcome of this series of discussion will be that we should be able to manage our diabetes with a lot of food and exercises without much of drugs. And if we haven't gotten diabetes yet, we should be able to reach a point not to have diabetes by a better lifestyle. So with this, I'm going to stop and we'll do a chit chat after this. Thank you very much. Please like, subscribe, and share. And number two, there is a link in the description for Patreon. There is another link to buy me coffees, and there is a link to support this work. Thank you very much. And I would see you in another few minutes.